started. Good afternoon, everyone. Welcome to the Permanent Foster Care Rate Structure Implementation Overview webinar. Thank you so much for taking time out of your day to be with us here today. For those of you that don't know me, my name is Emily Smolson. I'm a project manager for the Children and Family Services Division here at CDSS, and I'm going to be supporting with the implementation of the Permanent Foster Care Rate Structure. So before we officially get started, I'm just going to note a few things. First and foremost, this webinar is being recorded and it will be posted to the Permanent Foster Care Rate Structure website in the coming days. We will put that link in the chat so that if you don't have it yet, you know what website to go to see that. We will also share today's PowerPoint slides out with this group following today's webinar so that you can access the information that we share today. And then part of today's agenda is to review some upcoming stakeholder engagement opportunities. We will insert the registration links for those opportunities into the chat today. They're also going to be hyperlinked within the PowerPoint that you will be receiving. And lastly, we will be posting those to the RATES website. So you can keep an eye out on the RATES website and you can also access those registration links there. And I touched on this a bit ago, but in case you just hopped on, today's overview is being hosted as a Zoom webinar, meaning that only the panelists for today's webinar are able to unmute and come on camera. So if you have any questions, please enter them into the Q&A. If we have time, we will respond to the questions at the end. If we run out of time, we will follow up with those responses. So thank you again for being here. Welcome. I'm going to pass it to each of our presenters now to introduce themselves, and then we will begin. All right. Diana, I will pass it to you first.
Hello,
I can jump in. Hi, I'm Angie Schwartz. I'm the Deputy Director of the Children and Family Services Division, and I will pass it to Sarah Rogers.
Good afternoon, Sarah Rogers, and I am with the System of Care branch within the Children and Family Services Division. I'm not sure Diana is having technical momentary difficulty, or pass it to Diana.
Good afternoon, Diana Wagner. I'm the Assistant Deputy Director for Children and Family Services Division. And I will go ahead and pass it to Laurel.
Good afternoon, everyone. Laurel Seema, the Adoption Services Branch Chief here at the Department of Social Services. And I'm not sure who I pass it to. Back to you, Angie or Emily.
We'll pass it to Erin next, and then Daniel.
Okay. I can't see everyone.
That's okay.
Thank you. Good afternoon, all. Erin Thuston, Chief of the Permanency Policy Bureau here at the Department of Social Services, and I will hand it over to Daniel Wilson.
Thanks, Erin. Everyone, Daniel Wilson here with the Integrated Practice and Resource Development Bureau in the System of Care branch. And I think that covers it. I'll toss it back to you, Emily.
Thanks, Daniel. All right. One quick note, I did say enter anything into the Q&A or the chat, but we're just going to use the Q&A today. So please just enter any questions you have into the Q&A. Thanks. All right. Okay, so this is just an overview of what we'll be covering. Today, we're going to provide a brief background on the development of the permanent rate structure, and then a quick overview of the actual structure itself. From there, we will provide an overview of how we've broken down the implementation of the permanent foster care rate structure and how we intend to phase this work throughout the next 3 years. Then we'll get into the implementation plan for each component of the rate structure. And lastly, we'll provide an overview of the upcoming stakeholder engagement opportunities and how you can join each of them. Okay. All right, so a bit of quick background. This slide shows just at a high level the journey that this rates work has been on thus far and where it's headed in the next 3 years. CDSS has been operating under an interim rate structure and had a statutory mandate to establish a permanent rate structure by January 1st of 2025. So we're first going to start by providing a quick overview of the stakeholder work groups that were held in fall of 2022 to inform the proposal that CDSS then worked on throughout 2023. Okay. So In the summer of 2022, we first held a larger kickoff meeting for the rates to kick off the stakeholder rates work group. So that was held July 14th of 2022. From there, 4 rates subgroups were established based on the consensus of that kickoff meeting in July. And those 4 subgroups were resource homes, ISFC, STRTPs, and FFAs. Each of those 4 subgroups met 5 times each from August to November of 2022. And then during one of the resource home subgroups meetings, the group requested that 2 sessions be scheduled to specifically discuss the SILP rate. So 2 additional meetings were scheduled to obtain feedback on the SILP rate. Following each of those 4 separate subgroups that were held, in December of 2022, we brought everyone back together for a 2-hour session and shared the findings of each of the groups and then the key themes across all 4 of those subgroups and articulated back what those key themes were to confirm that we were accurate in our understanding of what those themes were. And so this slide here just shows what those themes were. And from the stakeholders, the themes across all 4 of the work groups were that rates needed to account for services and supports, as well as care and supervision, that the rate should follow the child and not the placement type, that the assessment should identify the child's level of need, not where the child should be placed, and that the current rates are inadequate across all placement settings. And in addition to this, the feedback we heard from tribes during the ICWA state plan regional convenings, a number of tribal advisory committees that year, and then tribal consultation was that culturally responsive services should be made available for Indian children and families. Indian children should not have to leave their community to receive those services, and that tribes should remain involved in a child's case. So with that feedback in hand, we used that to inform the proposal that was then developed throughout 2023. So I'm going to pass it over to Angie now just to provide a high-level overview of the permanent foster care rate structure.
So those of you that have been with us on this journey throughout 2024 know that there was a proposal that was introduced in January as part of the governor's budget. There were more meetings that were held. There were significant changes made as part of May Revise, and then additional changes before the trailer bill was finalized and signed into law. And that is where we are now. So we are very excited to be at this implementation phase of the rates work and to have not a proposal anymore, but a final permanent rate structure that we are all working towards. And so if you go to the next slide, there are 3 key innovations. If you've been on this journey with us, you've seen these slides before, but we thought there's a lot of people joining us today. Some people may be new to this conversation. So we wanted to make sure there was a little bit of context on what the 3 innovations are that are part of what will be our permanent foster care rate structure that we'll implement in June of 2027. And then we'll focus the rest of the time today on really laying out the work before us to get to being able to implement the rates to fidelity and to achieve all of these new innovations and visions starting in June of 2027. So the first is that the tiers are based on the child's assessed level of need. So utilizing the CANS, the Child and Adolescent Needs and Strengths tool, we will be using that in order to determine which of these tiers a child falls into. And you can see there's 3 different tiers possible for any individual child, but the highest tier, tier 3, is broken up by age. We have a tier 3 for 0 to 5-year-olds. We have a tier 3+ for kids 6 and older. That's because the CANS latent class analysis showed real differences in the kids with the most complex needs. And so we account for those needs differently within tier 3 and 3+. But for any individual child, there's one of 3 possible tiers. Next slide. The second innovation is that we are no longer only supporting care and supervision as part of the permanent rate structure. We heard, as Emily just said, in the workgroup meetings that we held back in 2022, how important it is to account for more than just care and supervision. We've heard from youth for decades about the need to invest in their strengths and to build their strengths and to have the ability for foster kids to just be kids and to be part of their communities and kept connected to their cultures. And that's what the strength building and maintenance dollars are all about. And so there'll be strength building and maintenance dollars provided to all of the children in foster care at each of the 3 tiers. So no matter which tier you fall into, there will be strength building and maintenance dollars provided to that child to support those activities. And then starting at tier 2 and continuing through tier 3, we also have immediate needs dollars. That's because those children that fall within tier 1 do not have immediate needs identified by the CANS. Those are urgent needs the CANS has identified as needing to be met in order for the child to be able to continue to benefit from their home and their school and their social environment. But kids within tiers 2 and then with heightened levels within tier 3 and 3+ have those immediate needs. And so we have those dollars available to make sure that we can address those needs and account for what those children really require in order to heal from that trauma. Next slide. And then the third innovation is the rates are not based on placement type, they're based on these tiers. And so we are agnostic as to placement. The children within tier 3+ get that care and supervision rate, which is paid to the caregiver, and the strength building dollars and the immediate needs dollars, regardless of the placement setting. So those children can be supported with that level of funding and service within a family home, within a relative's home. Really, that's really the intention, that we're supporting children even at the highest level of need within family placements where we know they do best and where they're most likely to be able to heal from trauma and be connected and thrive. So the rates are no longer, there's no STRCP rate anymore. All the rates are based on the needs of the child and intended to support the child in whichever placement they will do best. And often that's the home of relatives. And I think I'm turning it back to Emily.
Thanks, Angie. All right, so we have a bit of background on the feedback that informed the development of the proposal and then what has since been chaptered. So with all of that in mind, we're going to shift to talking about implementation and the next 3 years. Okay, so we've broken down the implementation of the permanent foster care rate structure into 5 key categories, and those are listed here. The first is CFT and CANS fidelity. The second is care and supervision. The third is the strengths building program. The fourth is the immediate needs program. And then the last and the fifth is the automation of the permanent rate structure within CalSAWS and CWS cares. And in addition to the 5 categories, we've broken down the next 3 years into 3 key phases. So the first is the planning phase, which started in August of this year and will go until June of 2025. The second phase is the preparation phase, which will start in July of 2025 and go until June of 2026. And the third phase is the early implementation phase. And that's going to begin in July of 2026 and go through June 30th of 2027, right up until payments go live for the permanent foster care rate structure. So we're now going to talk about what we will be doing in each of the 5 categories of implementation throughout the 3 phases of implementation. So the first category we'll be covering is CFT and CANS fidelity, and I'm going to pass it to Daniel.
Great. Thank you so much, Emily. Hi, everyone. Daniel Wilson here. So as it relates to the first component of implementation, the child and family team and the child adolescent needs and strengths tool, as many folks are aware, CFT and CANS in California are inextricably related and tied into each other, and fidelity of the CANS is related to fidelity of the child and family team and child and family team meetings to really make sure that voices and any individuals who have information and connection to that child and that family are part of the CFT meetings that are ultimately informing the CANS. So there's multiple voices, inter-rater reliability, contributing to the item ratings within the CANS. We can move to the next slide. So for the planning phase, July 2024 through June 2025, as it relates to CFT and CANS fidelity and implementation, as was previously shared, In July, the permanent foster care rate structure was chaptered. Throughout July, August, and really into September, there were a series of work groups that have contributed to the development and guidance, the standards for the integrated practice CANS, both in terms of the policy changes that align with the foster care rate structure, statute, and fidelity requirements. And those groups historically have met for, there's been work groups around CANS and CFT meetings as it relates to fidelity for many, many years. And those have been continued and built upon to really inform the guidance and the standards that are being developed as part of the permanent rate structure. So through September, October, November, and into December, the guidance and standards as it relates to the use of the IP CANS this is inclusive of the direction for probation's utilization of the IP CANS is being developed. Concurrently, through those months, September through December, guidance is being drafted as it relates to CANS fidelity. In January, we anticipate that those two policy letters will be released, one ACL pertaining to the guidance as it relates to the policy timelines, probation's use of the IP CANS. That will be one ACL released in January, and the other ACL will contain information and guidance as it relates to fidelity requirements around the IP CANS. Through February through June of 2025, CDSS will use these letters and this guidance to work with placing agencies around fidelity to the IP CANS. And also during this time frame, CDSS and the Department of Healthcare Services have been working on an alignment letter to align the CANS between the two departments. And during that time frame between March and May, that CANS alignment letter jointly issued by both departments will be released as well. Then we can move on to the next slide. So moving on to the next phase, the preparation phase, much of July 2025, or all of July 2025 through June 2026, will be used for CDSS to work with placing agencies to enhance and upgrade fidelity to the IP CANS. Also beginning in December through May, CDSS will develop an iteration of the CANS fidelity tool for administrative law judges to use when a child or family indicates their CANS assessment was not completed to fidelity. Stakeholder engagement and engagement with tribes will also inform this process, but this piece is really about the due process framework around the IP CANS and the foster care rate structure. And then in June of 2026, the department will publish the CANS fidelity tool for the administrative law judges. Next slide. And the last phase of implementation, or at least during this period of time, the early implementation phase from July 2026 through June 2027. Again, during this entire time, the department will continue to work with placing agencies to enhance and improve fidelity to the IP CANS. July through September of 2026, CDSS will partner with ALJs and conduct training for administrative law judges in the courts on the IP CANS fidelity tool. And from October through June, from October 2026 through June 2027, the department will conduct the necessary trainings and webinars and overviews ahead of the permanent foster care rate structure, beginning payments in 2027. And with that, I will pass it over to Laurel Sema.
Thank you, Daniel. Laurel Sema here, and today I'm here to speak with you about the implementation of the Adoption Assistance Program and the Kin Gap implementation of the rate structure. Next slide. So CDSS will be engaging in January of 2025. We will embark upon a work group to address the specific conditions under which families receiving AAP or kin gap may be paid on the amount to exceed tier 1, but not to exceed tier 2. So we will be working on specifically criteria to address those folks that will fall into that category. The plan is to be we'll be working on the work group from January to April roughly, and then we will draft guidance based on recommendations from the work group on the conditions under which, again, families will receive that exceed that amount of tier 1, but not to exceed tier 2. Next slide. So after we draft the guidance, then from July to October, we will be kind of specifically releasing that and talking about, again, the recommendations from the group. And then we will publish it, actually, excuse me, from November to December. So by the end of next year, 2025, we will have published the guidance so that everybody's aware of the criteria. And the next slide, please. And then we will be, once we've got the guidance out, then we will be conducting the necessary trainings, webinars, and technical assistance calls ahead of the rate structure going live. And I think it's on to Erin.
It is. Thank you, Laurel. So today, you all, I get the opportunity to share with you our next steps for the Strengths Building Program, and I, Erin Thusten, am one of your co-leads. And so next slide, please. So we have already internally here at the department have hit the ground running. Over the last couple months, we have formed our internal working teams and begin operationalizing what that looks like, including weekly meetings on the topic. In the near future, i.e. in about a month, we will begin to have our listening sessions because we acknowledge that we need your input strongly and deeply. And so further on in the presentation, you will get more information, but in November and December, we will be having listening sessions for stakeholders and listening sessions specifically for tribes to get your input on what we need to include in our RFI, our request for information, because ultimately we all know you have insightful information to help us determine the best person for our financial management coordinator and all the tasks we need to consider. And so between now and the end of the year, we'll be doing that. And then concurrently, we will be taking the information from you all that we've gathered during the listening sessions and begin to draft the RFI. Ooh, a lot of acronyms. We will draft the RFI for the financial management coordinator for the Strengths Building Program. So the RFI for the FMC, for the SPB. Goodness. And then once we start to get that launched in the new year, we will also come back to you all because we're going to need some more perspective and engagement around the requirements that are in the statute. So we need your engagement and your thoughts on our standards of care framework, the plan, the training materials, guidelines, services, et cetera. And concurrently, we will be preparing and reviewing the same information with our partners who are tribes. And then we will take all of this information again to really inform and develop the draft of the RFP, which will come after the RFI. So we will release a request for proposal to determine who will be our financial management coordinators. And we plan to have the RFP released by April of next year. And then we will spend the next couple months of this current fiscal year reviewing and selecting a final person or entity to be the FMC, the financial management coordinator. That's our steps for this next year. And then as we go into the next phase, next slide, please. We will be in a place where we can develop and draft guidance on the items you see before you. And so know that we will likely come before you again, asking for your feedback. Concurrently, we will be able to finalize and select a provider for our FMC. And then during the second part of our preparation phase, so from November through the end of that fiscal year, which will be 2026, we will draft and prepare the contract so we can have that in place as we, next slide, officially launch the program at the tail end of June 2027. By July 1 of 2027, we will have a live contract in place. And we will also be developing and publishing guidance to speak to the standards, the education and training requirements, guidelines, et cetera. And so again, expect in the summer of 2026 for guidance to be released for your, again, stakeholder input to keep us moving along and keep moving things forward. And so that's our very robust 3 phases. And I'm going to hand the next section over to Sarah Rogers.
Good afternoon. Thank you so much, Erin. For those who are familiar, or maybe actually less familiar, the Immediate Needs Program is, if you recall from the earlier slide, available to children who qualify under Tier 2 and Tier 3 in the rate. And so those are children who are identified as having more significant immediate needs per the decision support model and the CANS. And so the vision here for the Immediate Needs Program is to ensure that when we identify those needs, that this program is our response to ensure that the needs of children are being met. So we know there are needs now identified and really measured, and the vision is to ensure that this program is built in a way that is able to respond and connect children to any of the services and supports across the system of care that they may need. And the vision is built on a high fidelity wraparound base. And so with that, we can go into the next slide to show our implementation plan. There's from July 2024 through June 2025, you can see here our timeline for activities in which we are engaging with stakeholders on building the training and capacity requirements. We recognize there's a lot of capacity building to be done to ensure that we have the provider network and the programming and training in order to meet these needs, a standards of care framework for the program, a process for certifying immediate needs providers. There is an intention that the state will ensure that all of our immediate needs providers meet these standards. We are required per the statute to have information on model contracts and really support that more standardized statewide implementation of a model of care for meeting these needs. We anticipate having guidance on regional immediate needs programs, recognizing that in many areas, a county by county structure may not be feasible due to economies of scale and the need for regions to partner and have a more regionally based model. We intend to have significant educational and other content for informing children and families about the Immediate Needs Program and what it does. And then identifying funding resources for the training and the curriculum to build up that capacity to really provide that standard of care that we're identifying here. So the additional deliverables here are building out data and outcome measures for the program, and really a threshold for how CDSS may enter into contracts if it is the case that a county or regional entity is not able to establish contracts to provide those services. So this is a kind of a way to ensure that all children are going to access these services, even if a county is having difficulty identifying those contracts. The other thing that's important to note here is that the statute requires us to have an integrated model or calls for an integrated model with Department of Healthcare Services. And there is a statute that establishes the construct of a wraparound case rate that the Department of Healthcare Services would establish. So we will be engaging with stakeholders with DHCS to that end, develop all of the analyses that you see here for executing those contracts. So I think we also note here that tribal consultation will be conducted in this time frame, and also continuing to develop the guidance over time. And go to the next slide. So this is about more the preparation stage of really building toward implementation versus the planning stages. So we anticipate here publishing these the following items and this time frame: training capacity requirements, the standard of care framework, the process for certifying the immediate needs providers, the development of those model contracts. So this is really about building the actual deliverables and releasing those deliverables so that we are moving toward actually implementing the program. So a lot of these are the same deliverables, but are identified here as the timeline by which they would be released and available for us to start actually implementing. And this carries us forward. Oh, can you go back one more time? From July 2025 to June 2026. Here, oh, and the one more item here to note is the providing to the legislature an analysis. So for this deliverable, there is a requirement that our department conduct an analysis as specified in the trailer bill to ensure that the funding and the rates framework is responsive to the needs of children as they are identified. And so we are working currently on the framework to conduct that analysis. And so in this time frame, we're required to provide that report to the legislature. Go to the next slide. And this is now in the early implementation stage from July 2026 to June 2027. And so here you see a joint publication of guidance between our department and Department of Healthcare Services for how the immediate needs funding would be used to support high fidelity Medi-Cal benefits. So when DHCS establishes the case rate, there's statutory language that permits our department to publish guidance for how the funds that have been approved in this rate proposal can be used to support that Medi-Cal high fidelity wraparound case rate. And the vision is really to ensure an integrated program that is highly responsive to the needs of our children who are in Tier 2 and Tier 3. The Department of Healthcare Services is simultaneously working to establish their case rate, but then our department will be establishing the standards for the immediate needs program. So I just really want to highlight the intersection of that Healthcare Services is establishing a Medi-Cal high fidelity wraparound case rate for the Medi-Cal services. Our department is responsible to establish the standards for the immediate needs program that is also founded on a high fidelity wraparound model. And then throughout the implementation phase here, you also see that we will continue to actually conduct the necessary training, webinars, and other deliverables for supporting capacity building and that quality improvement to achieve the vision of the immediate needs program ahead of the actual payments going live. And then throughout this time, you see that we will begin certifying immediate needs providers consistent with the standards, which in general can be understood to be consistent with wraparound standards of care, but in a way that is responsive and accountable to the needs of our children that we have identified under the CANS and other sources. Can go to the next slide. I think now I hand it to Diana. Is that right?
Yeah. Good afternoon. So I'm going to talk to you just a little bit about the implementation plan for the automation of the new rates. And so if we go to the next slide. So as you can see right now, currently, CWS Cares is in the process of doing the automation of the decision support model so that it will be in version 1 of Cares in order to support the go live of our new rates in July of 2027. Also currently in process, and I would probably say that we started it, at least the discussion with CalSAWS back this spring, is really to develop the all-county letter for the automation process for CARES and CalSAWS. The goal is to really have this ACL published by January of 2025 so that CalSAWS is able to begin developing and building it into their system. And then looking at February through June of 2025, CalSAWS and CARES are really working to automate the necessary components of the permanent rate structure. And then if we go to the next slide. So really through fiscal year July 2025 through June of 2026 is really continuing to build out the automation that's necessary for the component in order to be ready for the July 1 of 2027 implementation. And if we go to the next slide, here you will see that in October of 2026, CWS CARES version 1 will go live. We will have everything built into CARES in order for them to, in order for that system to really capture the information from CANS straight into CARES. And then also working on that link that will go over to CalSAWS in order to transfer the information of the tier. And the plan is that CalSAWS will be conducting testing and training to prepare for go live of the rates from January through May of 2027 with a plan to start as of July 1 of 2027. So it is our goal and our plan within this structure to have everything automated for the new rate system. And I'm going to go ahead and pass it over to Emily.
Right. Thank you so much, Diana, and to all the presenters. Okay, so we started with a bit of background on the feedback that led us to the structure as the whole, and then we've broken down the 5 categories within the permanent foster care rate structure for implementation, and then the 3 phases throughout the next 3 years for how we intend to phase this work. So now we want to discuss just the tribal and stakeholder engagement opportunities that are being coordinated for the remainder of 2024 and for early 2025. And just noting, this will not be the extent of the times that we engage with you all. These are just what we have kind of coordinated at this moment, and we will definitely be circling back on an ongoing basis throughout the next 3 years to continue to engage. So I'm going to actually pass it right back to Daniel to just discuss some of the engagement that's been happening for that first category, which is the CANS and CFT fidelity.
Thanks so much, Emily. And of course, all of this is being done with stakeholder engagement and engagement of tribes, and stakeholder engagement is really critical to all of this work to make sure and ensure that diverse perspectives and experiences are reflected in different roles, lived experience, experience of the tribes. All of that is really critically important to roll into all of this and to make sure it works well across our state as we engage in these implementation efforts. So regarding specifically tribal and stakeholder engagement with CFT and CANS, much of this dates back to 2018 when the CFT CANS implementation team was initially created, and many of the initial fidelity tools, resources, guidance, and support was developed as a part of that team. And in 2023, sorry, I'm going back 10 years. In 2023, the structures were revamped to create multiple teaming structures that were interconnected in their communication and the work they were doing. And through that, there was robust stakeholder engagement from various system of care state and local partners, including tribes and folks with lived experience. From these work groups and the CFT CANS statewide forum, which is what the implementation team is called now, CFT and CANS curriculum, tools, and communication and messaging documents and resources were developed. And the CFT CANS statewide forum is an open meeting or an open forum who anybody can join that meets quarterly to convene stakeholders from across the state to share information and engage stakeholders in discussions and provision of feedback that supports the evolution of CFT and CANS policy and practice in California. And we can put the link to join the CFT CANS statewide forum in the chat, and that will be a key source of communicating information and obtaining feedback as it relates specifically to CFT and CANS implementation and fidelity activity. Through this kind of revamping of the structure in 2023, the CFT CANS steering committee was also formed. That's a smaller set group of individuals that's really comprised of key statewide implementation partners from all across the system of care, including child welfare, CDSS, behavioral health, regional centers, education, school districts, tribes, and individuals with lived experience that meets quarterly to guide statewide goals and priorities in partnership with the state departments. And we can move on to the next slide. So digging in a little deeper into the stakeholder engagement, the department has partnered in partnership with the department's Office of Tribal Affairs to invite tribes to each of these sessions, and will continue these tribal engagement efforts, including scheduling listening and discussion sessions with tribes. Additionally, there was tribal engagement through the process of developing the CFT Tribal Engagement Guide. And as I shared earlier, CFT, Child and Family Teaming Fidelity, is a foundation to CANS Fidelity. And that CFT Tribal Engagement Guide was developed based on a report developed by the California Tribal Families Coalition in conjunction with many tribes around strengths and areas of improvement around the child and family teaming process and tribal engagement in that process. The subsequent CFT Tribal Engagement Guide was developed in partnership with UC Davis, the California Tribal Families Coalition, and tribal representatives, and additional webinars, training, and coaching opportunities are also under development. And tribal inclusion in CFT meetings and CANS completion is imperative to CANS fidelity for children and youth who were found to be Indian children or reason to believe the child is an Indian child. So we have worked and will continue to work to engage tribes in all of these different stakeholder engagement activities. And specifically, one work group, the CQI Fidelity Work Group for CFT and CANS, really focuses on digging into some of the nuance and the details of the various fidelity tools and CQI continuous quality improvement tools and guidance and documentation as that rolls out. And this work group formed in August of 2024. And it meets every 2 hours, every 2 weeks. And in addition, there were listening and discussion sessions were held throughout August and September of 2024 as it relates to CFT and CANS fidelity and the different perspectives that were specifically engaged in this process are listed on the screen here. Due to time, I'm not going to go through each one of them, but lots and lots of feedback, stakeholder feedback, and tribal input provided so far, and more activities to come. And again, we'll be working, partnering with our Office of Tribal Affairs to engage tribes in an additional listening and discussion session as well. And with that, I will pass it back over to Emily.
Thanks so much, Daniel. All right, so for the second category of implementation, which again is care and supervision, Laurel touched on this earlier, but just wanted to share some specific information about the forthcoming opportunities. Beginning in January of 2025, CDSS will engage that work group that she referenced on the specific conditions under which families receiving AAP or CANS may be paid to an amount that exceeds Tier 1 but does not exceed Tier 2 care and supervision. So the specific dates and time for this work group are being calendared, right? We're coordinating those currently. So there isn't a formal invite for those as of yet. But in the interim, we've set up a sign-up sheet that is hyperlinked here. We're going to pop it into the chat so that if you are interested in attending these, once these are formally calendared, you can sign up via this sign-up sheet, I'm sorry, and we'll get that calendar invitation to you. We anticipate that being ready in early to mid-December. There's a slide later in this PowerPoint that has my email address on it. If you sign up and you don't end up seeing that calendar invite come through by mid-December, feel free to send me a quick note and we'll be sure to get you signed up for that. All right. Okay. And then the next stakeholder engagement opportunities are for the strengths building program. So Erin did reference a number of listening sessions. So the first is going to be on Thursday, November 14th from 1 to 2 p.m. For stakeholders to provide input to inform the RFI, the request for information, and then the RFP, the request for proposal for that financial management coordinator that Erin described. So that first listening session is going to take place on Thursday, November 14th. And then we will be having a second listening session on Tuesday, December 10th from 10 to 11 a.m. And that's going to be a follow-up session. One, we can certainly take in additional insights at that time if anyone has anything they want to add, but we will really want to use that opportunity to kind of verify understanding, to share back what we heard in that first listening session on November 14th, and then use that to inform the development of that RFI. All right, and so if you're interested in attending one or both of those sessions, those links are also being shared in the chat. You can sign up there. They'll also be in this PowerPoint that we'll be sharing out, and then we'll be getting all of this information posted to the RATES website. All right, and then just wanted to note it's not listed here, but we are also working with our Office of Tribal Affairs colleagues to conduct a listening session for tribes on the Strengths Building Program. That's also going to be taking place on November 14th, and we're working with OTA to get that invite out via the CDSS OTA inbox. All right. So that is for the Strengths Building Program. And then moving on to category number 4, the Immediate Needs Program. On Thursday, October 31st, from 1 to 2 p.m., CDSS and DHCS will be hosting a listening session to inform the immediate needs and cost analysis that's required in statute. So if you're interested in attending that listening session, there is another registration link here. We're also putting that into the chat so you can sign up for that. And just wanted to note that this will be the first of some ongoing engagement as it pertains to the immediate needs analysis that will occur in both 2024 and 2025. But this is the first one that we have calendared, so wanted to share that out. And then also just noting that similar to the Strengths Building Program, we're also working with our OTA colleagues to set up a separate listening session for tribes for the Immediate Needs Program. All right. And then for our last category of implementation, the automation of the permanent foster care rate structure. As Diana noted in her portion of the presentation, CDSS is currently drafting the all-county letter, the ACL, to inform CalSAW's automation of the permanent foster care rate structure. And we anticipate releasing this to stakeholders for review in early November. This draft ACL will be shared with the Children and Family Services Division, ACL and ACIN stakeholder review distribution list. If that is not sounding at all familiar to you, but you would still like to receive this draft ACL, please just send me a quick note and we can make sure that if you are not otherwise on that distribution list, but you would like to see this ACL, we can make sure that that gets to you. And then this slide here is all of the same information. It's just essentially a visual that provides a summary of everything in its totality as it pertains to stakeholder engagement opportunities for the end of 2024 and early 2025. Erin and Sarah both touched on this a bit, but just wanted to note that per the implementation slides in the earlier sections, we will be coordinating additional stakeholder engagement opportunities for the immediate needs program in early 2025, and then same thing in March of 2025 for the strengths building program. So you don't see anything on here yet, but that is on our radar and we will be getting that coordinated. We'll follow up with this same group with those opportunities. And then any and all of these opportunities will always be posted to the rates website. All right. Okay, and that is the extent of what we had to cover today. So again, we will be sending out the PowerPoint slides to everyone that attended today. So you will get those either later this afternoon or very early tomorrow morning. We have been recording this webinar, so that will be posted to the permanent foster care rate structure website. And then again, all registration links for those upcoming stakeholder opportunities that we talked about today will be posted to the website. And we do have a few questions in the chat. I don't know that we're going to be able to get to all of them. So I might try to pull one or two out quickly just to touch on, but for the ones that we don't, we will take those back and we will follow up. All right, Angie or Sarah, I don't know if you want to take this one, but it says, I may have missed this, but will the higher tiers replace the specialized care increment?
The answer is no, they're not replacing them. The specialized care increments are county specific, and so different counties operate different specialized care programs. They're optional, and counties will continue to have the option of having specialized care.
Thanks, Angie. All right. And Sarah, another question is, how are immediate needs being defined? Is this inclusive of special healthcare needs and what we currently think of as ISFC?
I think I would answer yes in terms of how we think about it as ISFC. In terms of how they are defined, the intention of the program is that we are designing a program that is responsive to the needs of children as they have been identified in the context of the CANS and the child and family team, and any other way that we know what the needs of children are. And so the intention is that a wraparound model and framework and culture is ensuring that there is a response and assurance that we have a plan for meeting those needs, whatever they may be, including potentially healthcare related needs or medical needs, as well as mental health or other needs. How that occurs is really intended to be consistent with wraparound practice and utilization of child and family teaming, but also in the system design. So the immediate needs program is intended to also engage with our system of care partners. I mentioned healthcare services where that integration is really built in, but the intention is also to ensure that there's connection and planning and design work happening on meeting other types of needs, including medical needs, regional center, developmentally disabled kind of related needs, or educational needs as well. How that occurs is part of the design work that we anticipate occurring in that first stage of implementation and through that stakeholder engagement. And we also anticipate a lot of engagement with our children and youth system of care partners in order to ensure that connectivity.
Thank you so much, Sarah. All right, I think we have time for one more question. So again, if you don't hear your question responded to, we will take these back and we will follow up. But Angie, this question came in, is this structure for children who have been adopted as well as children who are currently fostering?
So children that have already exited to adoption or guardianship and are receiving AAP or CAN benefits will continue to get AAP and CAN benefits under the existing rate structure, so the interim rate structure, even after the new rates are implemented. After the new rates are implemented, families exiting to adoption or guardianship after that date will exit and be eligible for AAP or CAN funding equivalent to Tier 1 care and supervision. There will not be the strength building dollars or immediate needs dollars for children that are adopted and receiving AAP or CAN. And then, as Laurel spoke to, there is a requirement in statute that we develop the criteria in which a family receiving AAP or CAN could negotiate up to the Tier 2 care and supervision level of support. And so that criteria has not yet been developed, and there will be a work group starting in January to determine when a child may be eligible to negotiate up to Tier 2. So it's Tier 1 for all families, and then with the possibility of negotiating up to Tier 2 based on the criteria that we'll develop.
Awesome. Thank you so much, Angie. All right, I think that is everything for us today. We will post those stakeholder engagement opportunities to the RATES website. We'll also be sharing out that PowerPoint from today, and we will circle back with responses to questions that we didn't get to. And then again, this webinar was recorded, and we will also get that recording posted. Thank you so much to the panelists today, and I hope everyone has a great afternoon.